Alright, welcome back to Phlebotomy Solutions. I want to give you some tips on how to properly take off your gloves and dispose of them without really having to touch them directly or cross-contaminating or carrying something on yourself after you're done using them. Now, you need to keep in mind a couple things. Gloves like these are not sterile. The ones you're using out of your box, they're not sterile gloves. Of course, they're open and exposed, and we do the best we can to keep them clean and keep them away from contaminants within the hospital. But remember, these are not sterile, so we got to be careful once we get these gloves and we're ready to practice or deal with the patient. So keep this in mind. They're not sterile. Okay, secondly is when we enter a room to draw blood on a patient, we got to keep in mind that when we go in there, we need to wash our hands first, make sure we're clean, and then of course before we touch or assess the patient, we go ahead and glove up. What we should not be doing is going into a room and touching everything, not washing our hands. And of course, even if we wash our hands, we shouldn't be touching a lot of stuff in the room and handling stuff and things that are already contaminated, could have blood or specimen on them, and then all of a sudden grab our gloves and put them on. Because now what we've just done cross-contamination. Whatever we were touching in the room, we've now put on our gloves, and that's what we're going to be exposing the patient to. So we need to be careful also with cross-contamination. We go into the room, we wash our hands, we glove up, we have our supplies next to us, and then we go ahead and assess the patient. We shouldn't really be touching anything else in the room. And if we do, we need to wash our hands again and make sure that we keep ourselves clean at all times. So I'm going to show you a couple things how I take off my gloves. Now again, there's no protocol that says you have to do it this way, but this is the way I've always done it, and I felt the safest way after I've drawn on a patient. So once I've assessed the patient, drawn my blood, and I'm done, I've labeled my tubes, did everything I was supposed to do, and I'm ready to now leave the room, and then of course take my gloves off, and then of course wash my hands again. What I want to do is I want to basically remove them in a certain way. Now again, everybody has a different way of doing them. This one I feel more comfortable, a little more safe in doing. What I like to do first is I like to pinch the glove right about here before I move it and grab it. I don't like to touch anywhere else on my skin or push my finger here right away, because whatever's on my glove, I don't want to get it on me anywhere on my body. So I want to go ahead and grab the glove that's already contaminated, just peel it off, crumble it up in my hand like this. Now this finger, I want to go ahead and take underneath the glove here. You can do it behind as well. People do it differently. You can do it from right here. Grab underneath the glove. Try not to touch the glove anywhere on top, but go ahead and grab underneath, put it underneath, and then just shoot it in your trash can. Then once I'm done, I'll go ahead and wash my hands or clean them, soap and water, and then go ahead and leave the room. And again, this is just a tip of how I like to do it. For me, it feels safer. I'm not touching the gloves. We got to keep in mind that once we put the gloves on, we don't want to be touching our face, touching our hair, touching anything other than the patient and our supplies, because again, cross-contamination. Whatever's on my scrubs or on the bed, we don't want to cross-contaminate that to the patient when we're touching and handling them. So we want to avoid touching our faces or anything like that, and always wash before we go in, wash after we leave. So again, I hope this helps. It's just a little tips on how to remove your gloves before, remove your gloves after you're done handling the patient, and how to handle a patient before you do your gloves. So again, this is Phlebotomy Solutions. I hope this helps, and again, happy holidays and be safe out there.